This week, we celebrate International Women's Day, so we will take a look at some health issues that impact women. 1 out of 6 couples struggle with infertility. Now, South Carolina legislators have introduced a bill that will require health insurance providers provide coverage. A Columbia woman is one of the women driving this movement. She's doing what she can to remove roadblocks in her journey to parenthood.
For us, financially, it has been a tremendous strain, and different infertility treatment options that we would have considered, we can't go that route because financially we just can't afford it.
39-year-old Andrina King married the love of her life, Christopher, in 2013. A few years later, they wanted to start their family.
Our journey started maybe about 2 years ago. My husband and I, we started the process in regards to, trying to start our family. And in the process of doing that, as we would go to doctor's appointments, they will always come back and say, well, your insurance doesn't cover this. My plan doesn't cover anything. My husband's plan doesn't cover anything.
Then Andrina looked for answers.
After, going to different appointments, I started doing research and things of that nature and saw that there are 15 states that do have mandates for insurance companies to cover certain things as it relates to infertility treatments. I started, contacting my local legislators, and we're excited to finally have the ball rolling where we have, the pre-filing of this legislation so that we can get some type of coverage. Of course, it would have some exclusions and things of that nature, but it would definitely make it more possible for a lot of couples to be able to explore other treatment options.
The bill S10, filed by Senators Glenn Reese, Kevin Johnson, and Mia McLeod, is currently in the Committee on Banking Insurance. It would require health insurance providers to provide coverage for the diagnosis and treatment of infertility, with exceptions.
It's very stressful. You work on a job, you pay for insurance, and then, when you have a lot of times it's medical issues why, couples can't conceive. And for them to say, okay, we're not going to cover this, it's very frustrating. So, we are really trying to get the word out, to get individuals to contact their legislators so that they can, really support the S10 legislation.
Dr. Stephanie Singleton with the Fertility Center of Charleston says cost is often a big factor when it comes to patients not getting help. She says depending on diagnosis, treatment can range from less than $1,000 up to $18,000.
Sometimes insurance will pay for it. More often insurance will pay for testing. They don't always pay for treatment. I think that's going to be incredibly helpful to a lot of patients. And we know that there are states, especially in the Northeast, that already have this kind of coverage. There are certain companies that supply this kind of coverage to their employees, and that helps those patients to feel more comfortable building their families and seeking this treatment.
Andrina says her faith and support groups have helped in this process.
Faith has definitely sustained us because this process is very draining emotionally, mentally, physically. I understand the impact that it has had on myself, and I know that I'm not alone in that process. We're excited. We know that, it's still a process. And so, we just need everyone out there, advocating to make sure that we get this legislation passed.
Some of the exceptions in the bill deal with age limits and the number of inseminations and sperm donations. Dr. Singleton says the Fertility Center of Charleston offers financing programs. They also offer medication savings programs that save patients 25 to 75% off their medications. For more on the infertility insurance coverage bill, head to our website, counton2.com.